Welcome to everyone. My name is Smitha Antony. Today I'm going to discuss about an issue that related to complementary therapies within current mental health practice. The issue is how to improve the effectiveness of psychotherapy by identifying and minimizing the barriers. It discusses in detail about the theories, the role of the therapist and the patient in psychotherapy, the effectiveness of different kinds of therapies that we are using at the moment, what are the barriers of psychotherapy and how to minimize the barriers. And also it describes about the reflection in my own practice and some of the recommendations to improve the therapy. The popular psychotherapies include DBT, which is dialectical behavior therapy, CBT, that is cognitive behavior therapy, family therapy, music therapy, occupational therapy, and EMDR therapy. EMDR is one of the leading therapy which the psychiatrists and the therapists are using for patients with post-traumatic stress disorders. Next, we can look into the theories of psychotherapy. Theories of psychotherapy are the explanations of functioning of human being and the process of change. Most of the theories emphasize on social attachment and the relations as it's play an important role in healthy personality. The problems exist in the society and community like social bullying, relational trauma, including childhood abuse. It can be either physical or mental abuse, or dysfunctional family also affects the mental health. Some theories are focuses on affect behavior and cognition of a person. Psychoanalytic theory aims at personality change, insight, integration and resolution of unconscious conflicts. However, cognitive behavior therapy focuses on distress reduction, symptom reduction, and adaptive functioning of a patient. There's another theory which is called humanistic or existential theory, and it explains the freedom, authenticity, meaningful existence, and self-actualization. The goal of multicultural theory is to do empowerment, reduction of barriers, oppression and privilege, and also aims at the opportunity to achieve goals in the life. Next, we are looking into the role of a therapist in psychotherapy. It is important to provide warm and safe environment to the patient and work professionally. Therapists should work to improve the psychological development of the patient. It is vital to develop a rapport with the patient for a successful treatment. Good communication and interaction between both parties are mandatory to achieve good results. Therapists need to be attracted to therapies and they have to find the therapies are comfortable, attractive, and interesting. Some therapists are comfortable with the behavior treatments and act as a teacher. However, some of them have interest in emotional management because of their interpersonal skills. The therapist should believe that the therapies work and it is effective. Therapists should practice and continuously work on the skills that are gained from learning the therapies of psychotherapy. It is mandatory to do continuing education by attending workshops, reading journals, attending short courses, and also update the theories from clinical educators and supervisors. It is very important for therapists to understand how the theory will be applicable to practice using the skills in order to achieve maximum effectiveness to the patient. It is the responsibility of the therapist to put some boundaries in therapy. Boundaries create a safe place for the therapist to work professionally and to keep healthy relationship. At the same time, there are some roles for the patient in psychotherapy as well. The patients need to take the responsibility to practice the coping strategies that are learned in the therapy session in order to apply at the correct time. Next, we are looking into the effectiveness of psychotherapy. The effectiveness of psychotherapy varies depending on the different circumstances. Some therapies do not work for some kind of mental illnesses. The effectiveness of therapy is different for different patients. It is important to choose what type of therapies are useful and more effective for specific mental illness. For example, emotional management program with dialectical behavior therapy and cognitive behavior therapies are more useful with patients having increased self-harm behavior and suicidal ideations. It is effective for anger management and also for all kinds of emotional dysregulations. However, EMDR, the eye movement desensitization and reprocessing, is effective for the patients with post-traumatic stress disorders with flashbacks. With the help of an effective therapist, psychotherapy works better long term. It is cost effective compared to medications and reduces the relapse of anxiety and depression. Psychotherapist teaches the patient how to use the skills and coping strategies when it is needed. Patients receive psychotherapies are more effective than patients do not receive psychotherapies, and also for most of the mental illnesses, therapies are effective as pharmacological treatment. In order to achieve maximum effectiveness, there are few factors need to be considered. It includes evidence-based practice and treatment which is appropriate to the situation, clinical experience of the psychologist, and your values, culture, and preferences. Sometimes patients become pessimistic about starting and continuing the therapies. However, psychotherapy helps the patient to adapt to the situation properly and function effectively by either improving the relationships, thinking optimistic, and doing better at work and school. Psychological therapies are effective across all age groups, including from children to other adults. It is a belief that antidepressants are a more effective method of treating depression. However, psychotherapy is the strong medicine for depression. Next, we can look into the barriers of psychotherapy. Psychotherapies cannot be effective in some situations, and there are some barriers that interfere the effectiveness of therapy. Lack of rapport between therapist and patient is a major barrier in psychotherapy. If blended psychotherapy is going on online rather than face-to-face, it affects the effectiveness of therapy, and sometimes patients are not able to open up the emotions. Some of the barriers are related to professional diversity of therapeutic clinicians. Psychotherapy is practiced by a wide range of professionals like psychologists, psychiatrists, counselors, social workers, etc., in a wide variety of settings, and the standard of training and continuing educations are different. Another barrier of psychotherapy is a limited supply of qualified professionals, especially in underserviced areas. Geography is another barrier to access psychotherapy. Some people are unable to travel long distances to access the services. Social stigma is a barrier in the community because people are committed to family and relationships, and they are frightened to access psychotherapy because of social status. They do not want to take time off from work to access the therapy, and also the stigma associated with mental health issues. Now we can find out how to minimize these barriers of psychotherapy and what we can do. It is important to make sure that bridging the care gap in patient care is vital. In order to remove and minimize the barriers, innovations has played a significant role. Digitally delivered and therapist-guided psychotherapies are the best option for people who does not have access to face-to-face therapy. Early assessment and identification of mental illness and starting therapy at the early stages helps to minimize the symptoms of mental illnesses. Long-term therapy is important to prevent and control the relapse of mental illnesses. Provision of ongoing education and teaching is mandatory to improve the knowledge level of therapists, and thus it helps with the patients. Awareness programs through media and newspapers are helpful to minimize the stigma regarding mental illnesses among the community. Provide opportunities to therapists to work from home if there are any barriers for communication like pandemic. It is vital to develop and maintain a trust between the therapist and the patient for better outcome. So open communication is essential to avoid any communication barriers. Next, we will look into the reflection in my own practice area. I'm working in a private mental health setting where the patients are getting admitted to do some specific programs like Living Well program, emotional management program, and eye movement and desensitization program. The role of the nurses and psychologists are vital in this situation. The nurses have the responsibility to provide enough support and reassurance to the patients and help them to utilize the skills that they learned in the groups. The psychologists are helping the patients to learn the coping strategies and grounding techniques in order to manage their emotions. It is important for the nurses and therapists to keep a healthy relationship by putting professional boundaries, and that helps the nurses and therapists to work within a safe therapeutic environment with the patient. It is necessary to understand the verbal and nonverbal cues from the patient so that the nurses can accurately sense what they are trying to communicate. Now we can look into the recommendations to improve psychotherapy outcome in my practice. It is very difficult to use the quality analysis when it comes to find out the outcome of psychotherapy because we do not know actually how the patients are doing. So it is essential to get a feedback from the patient to closely monitor the outcome. The other recommendation for therapists is to clearly explain the reason of distress on the basis of psychological theory and how therapy will help them to cope with the situation. It will improve the outcome of psychotherapy definitely. Therapists need to be flexible with the treatment requirement of the patient, and sometimes therapist has to completely change the style of therapy in order to improve the outcome of therapy. It is recommended that therapists need to help the patient to process their difficult emotions and they would like to avoid all the time. So therapists need to challenge the patient and provide adequate support to overcome the challenges in a positive way. In order to improve the outcome of therapy, it is essential to take some responsibility from the part of patient as well. Advise the patient to bring all the personality and emotions to the session. Keep focusing on yourself. Keep a professional connection with therapist. Advise to take the responsibility of your own behavior. Utilize the strategies that learned in the session and use the triggers as opportunities to grow. Some patients need long-term therapy sessions than short-term, depending upon their level of trauma and distress, and it is important to continue with the therapy sessions to prevent early relapse. For example, patients with post-traumatic stress disorder need multiple eye movement desensitization and reprocessing sessions in order to relieve the traumatic experience that happened in the past. To conclude, psychotherapy can improve the symptoms of depression, anxiety, panic attack, OCD, and other kinds of mental illnesses. So the therapists need to analyze the role of patient and therapist in order to provide a maximum outcome to a mentally unwell patient for the speedy recovery. It is important to identify the barriers of psychotherapy and minimize the effect of barriers by providing a safe and private environment for the patient to communicate effectively. In a private and public mental health setting, group and individual therapies play a major role in recovery of the patients in order to prevent the relapse of mental illnesses after hospitalization. It is important to make sure that the nurses can act as a counselor and therapist whenever a patient is in need. Thank you.